Hi, this is Tina. Thanks for coming back to my YouTube channel, and this is episode number 3. In this episode today, I am going to be talking about my stats, which I think are pretty important, as well as a couple of days before my surgery and after. Today is 1 week and a day after my surgery, so it's 8 days. First of all, I just wanted to explain the procedure that I've had done. I came to Poland to have a vertical gastric sleeve, or otherwise known as gastric sleeve. A gastric sleeve is when you remove 80 to 85% of your stomach. They shape it into a banana shape, and you can fit about 4 to 5 ounces of food in that pouch. They also remove a hormone which is called ghrelin, and this is the hormone that causes you to feel hunger. For my stats, my episode 1 was filmed on September the 26th. I was 238 pounds. I was 107.9 kilograms, and my BMI was 39.6. My second episode was on October the 1st, and that was my pre-op consultation. My weight at that time was 229 pounds, 104.3 kilograms, and my BMI was 38.1. October the 10th, which was 2 days before my surgery, when I checked into the hospital, I was 224 pounds, 102.4 kilograms, and my BMI was 37.3. At that point in time, I had lost 14 pounds, or in kilograms, 5.5 kilograms already. My first weigh-in was just today, and this is 7 days after surgery, and I'm really excited. I don't know if you can tell, but I'm like super excited to report that I am currently 215 pounds, 97.9 kilograms, and my BMI is down to a 35.8. That means I have lost 23 pounds or 10 kilograms in 24 days already. So I'm really excited about my results, and I feel better already. Now I'm going to tell you a little bit about my journey. As you know, during the 10 days beforehand, I did lose the 5 pounds, and there was all protein, veggies, no alcohol. It was very difficult. I love my alcohol, I love drinking wine, and I love carbs. So I think that even though it was only 5 pounds, it was still fairly successful, and it gave me the boost that I needed. On the day of admittance into the private clinic, which is in Wroclaw, I probably said that wrong. I call it Wroclaw. That's how it looks on the map, but it is Wroclaw, Poland. I was admitted into the clinic called EMC Medical Institute. My doctor was Dr. Wroclaw, and he had explained to me when I first met him, he was a gentle surgeon, and I can assure you he was. I want to personally thank Dr. Wroclaw. He was amazing during the whole process. I would highly recommend him, the nurses, and his clinic to anyone. The nurse care was 24 hours a day, and they were excellent. There is a reason why he is so highly regarded in his field. He's very successful, and from my own experience, I can ascertain he is an excellent surgeon based on my results and my speedy recovery. Not only is he an accomplished surgeon, but he's a wonderful man too. He really cared about me. I truly felt that. And I think if you're going through a process like this, you want to have someone like him by your side. Once admitted into the private clinic, I filled out a lot of paperwork, I got signed in, and I had to make the final payment for the surgery, which was 17,500 zloty, which equals 5,741 Canadian dollars. That's for a total of $7,250 for the procedure, all the medications, a 6-day hospital stay, and the surgery. I had a very nice, clean room. It was semi-private, so I did have a roommate, but she was very nice. It also had a beautiful bathroom that had a walk-in shower, so it was very easy for me to shower after the surgery. The remainder of the next 2 days before my surgery were filled with tests and consultations, which included meeting with a dietitian, a psychologist, an endocrinologist, cardiologist, pulmonologist, gastroenterologist, and the anesthesiologist. Sorry if I said any of those wrong. The tests that I had were spirometry, which is testing of the veins, and a gastroscopy, which they go in with a camera and check out the insides of your stomach and esophagus. I also had an ultrasound on my abdomen and multitude of blood tests. They checked my liver, they checked my coagulation, my kidneys, my hormones, and my virological assessments were done. The results of all the testing was that I was very healthy and qualified for the surgery. However, they did happen to find a very large 22 millimeter gallstone in my gallbladder, which we decided, the doctor and I, that I would deal with that in Canada with my own health insurance. While I was in the hospital for the 2 days before getting all these tests done, I had very limited food and water. Luckily, I had reduced my diet, but I'm not gonna lie, I was totally angry. Yes, hangry. I was starving and I felt like that was probably the hardest part of all of this, was those 2 days without the food and water. The morning of my surgery, I met with Dr. Raphael again, and we just went over a couple of things. He explained that the surgery could be 60 to 90 minutes if there were no issues, or it could be longer. I was also given a surgical outfit of what I would be wearing in surgery, and when the nurse walked in, he said, "Here are the garments to put on." And I said, "Oh, is that a hat?" I put on my head, and he laughed and he said, "No, those are panties. You can put them on in the bottom." So I thought that was kind of funny. I went into the bathroom, I showered with antibacterial soap. When I came out, I put on the gown and I went to put on the panties, and they were extremely tight. In fact, I did end up ripping them. So when the nurse came back, I did ask him if I could get another pair. And he came back and he said that he couldn't find any panties that were bigger, which surprised me because I'm in a weight loss clinic and there's overweight people everywhere. And some of them are, bigger than me. So I found it hard to believe that there was no panties that were a size bigger. Well, he did find some shorts that you wear when you get an endoscopy. Okay, and what that means is that they're little paper shorts with a hole in the back, so they can, Anyways, I put those on and they were tight. I jumped into the bed and I ripped the whole back end of the shorts. Oh my gosh. It was embarrassing, I'm not gonna lie. And I thought, oh my gosh, I've got to ask this poor guy for another pair of shorts. He's gonna think I don't know what he was gonna think. Anyways, so he brought me another pair of shorts in which I put them on as carefully as possible, and I got into the bed very carefully. I just wanted to say that this is kind of the last kick in the pants for me. I've had many instances in my adult life where something has not fit, whether it be when I go for a massage and they give me the house coat. Yeah, those never fit. I always have to get the guys' ones. Or, different circumstances. It turns out things like that never fit on me. So I felt like, this was, for me, the last thing that confirmed why I wanted to do this. My surgery was on October 12th at 2 p.m. I was really nervous about 30 minutes beforehand. My husband was with me. He did help to calm my nerves, and they also gave me a sedative to make me calm as well. It's probably the first time I haven't cried. I think I was actually really excited to finally get the surgery done. I can't imagine waiting 2 years for this because I've been waiting since September 1st when I first found out I was going to do it, and it felt like ages. After the surgery, I came to and I felt no pain at all. In fact, I was so happy. I got my husband to take a photo that I could send all my friends, and the response was, wow, you look great, you look high. And in fact, I was definitely enjoying the medication. I felt awesome, and I'm thinking, why doesn't everybody do this? So now they did take me off that medication several hours later, and then that's when I felt the real effects, which was there was some pain in the stomach area, and that was because there was 5 holes, and of course that's gonna hurt. I spent the night in recovery with 6 other people. They had had surgeries as well, ranging from gastric bypass to vertical sleeve. I think I was the only one that got the vertical sleeve actually. I was allowed to sip from little vials of water throughout the night. I couldn't sleep, and I did vomit twice. The thing is that it's not going to tear your stitches. It's not going to negatively affect your stomach, because that's what I was really worried about. And the liquid that I spewed up was black, and apparently that is just the dried up blood coming from your stomach from having your stomach stapled. So I was a bit nervous about that, but I was assured that there was no issues there, and that was perfectly normal. About the laparoscopy, I have 4 little holes, and I also have a 1-inch incision, and that is where they remove the stomach from. They are already healing wonderfully, and there shouldn't be scarring. The 1-inch one, there might be a little scar, but again, I'm going to put on bio oil on that. The next few days were spent resting, getting up and walking around. That's extremely important. So if I can give you a tip, is as soon as you can, get up and walk around. What it does is it releases the gases from your body, especially your chest area. I found that was the hardest part for me. So you want to get up and walk around so you can burp and have some flatulence, because that is going to relieve the pressure from your chest. So get up there. So I was getting hourly needles from anywhere from blood thinners to testing my blood to giving me pain medication whenever I needed it. And it was unlimited, but I chose to try to keep the pain medication down. So the first 2 days I was on a clear liquid diet only, which consisted of water. On day 3, I was graduated to having water, natural yogurt, and also tea. So that's what I was able to have for the next couple of days. So on day 6, I was allowed to go home, and my husband picked me up and I was released from the hospital. But I did meet with Dr. Raphael, and he checked me over, and he was very excited. He wants me to keep in touch with them. He wants to check in on me every 3 months. I have to send him some blood tests, but he's very excited to see how things progress with me. My weight then was up, and you know, I have to say, don't check your weight after this surgery until day 7 or 8, because if you do, you're gonna feel depressed. I made the mistake of weighing myself a couple of days. I think even on the day of release I weighed myself, and I was up to the 229, which is 104 kilograms. I also researched that was due to the gases still remaining in my body. So do yourself a favor, do not weigh yourself until at least day 7. Okay. This past week was spent resting, going for short walks, and living on an all liquid diet. Not fun, although much better than just water. I have been drinking water, tea, yogurt, and soup broth. I have to have about 48 to 64 ounces of liquids, clear liquids a day. Believe it or not, very hard to do, very difficult. I'm constantly sipping water and sipping yogurt, and because my stomach, I can only take a few bites at a time of anything thicker than that, and it's amazing that you do not feel hunger. You do not feel hunger. Now, your brain remembers taste and smells, so my mouth does water all the time, but at least you don't feel the hunger anymore. This week, I have been out to restaurants a couple of times because I'm out in Poland with lots of friends, and the restaurants have been extremely accommodating, and they've been able to give me soup broth. So I didn't feel like I was missing out at all, and it was actually nice to be able to still socialize and to test my patience and see if this is if I'm going to be able to do this in the future. So it was pretty easy. I did bring along a protein shake just in case, and I've also been drinking a lot of water with electrolytes as well. Speaking of vitamins, wow, okay, I have gone to the pharmacy and I have spent over $200 Canadian on vitamins. It is pretty crazy how many vitamins you have to take. Now, apparently, I'm going to be taking these vitamins probably fairly consistent over the next year, and then I can taper off some of them after. Every day I get a needle in my stomach, and that is a blood thinner, and this is for the next 30 days. This is so that I can fly on the airplane and not have to worry about any blood clots, and I also have to wear the compression socks on that flight as well. Once that flight is done, I take them for a few more days, and then I don't have to take the blood thinners anymore. The needle is very, very small, and it actually doesn't hurt. Thank God, because I am such a baby when it comes to needles. In fact, near the end of my stay at the clinic, I was actually begging them not to give me any more needles, and I made them cry. So right now, I am not feeling any pain in my stomach. I am very tired and low on energy, so I don't go for long walks, but every day it's getting better and better. My only other symptoms that I have are that I'm low on sleeping, and I have some tightness in my neck and shoulders since I had the surgery. And the last thing I have is every night before I go to bed, I have a headache, and that could be because I'm not eating what I used to, and I really am trying to drink as much as I can, but it could be that I'm not drinking enough. So my goal over the next couple of days is to increase my water intake. Otherwise, I am doing fantastic. I am so happy that I got this done, and the fact that I am down 23 pounds already is phenomenal. Basically, I only have another 40 pounds to go. So I'm hoping it doesn't take 40 days to get rid of that, because I would like to kind of, go about this slowly. So this has been very fast so far. My target is to lose around 1.5 to 2 pounds a week at minimum, or maximum, I mean, sorry. And yeah, so that's that for now. I hope you liked my video. I know this one was a little bit long, and that's because a lot happened. I imagine going forward, I'll be more direct and to the point. Anyways, I hope you like my video. Please like it, please subscribe, and if you have any questions for me, just put them in the comments and I'll answer any questions that you might have. Okay, all right, awesome. This is Tina, traveling to a new me.